Patients who stay at home as long as possible have a better labor and delivery experience, period, right? You're in your safe place at home where your comfort is, where you can be in your own bed, in your own space. You don't have the restrictions, the rules, the regulations that you can sometimes face in a hospital setting. You don't feel the anxiousness, the worry, the fear that sometimes can come along with being a sterile medical setting. So I find that patients have a much better labor and delivery experience when they stay at home as long as possible. Now, I do not want you scared or worried at home. If we've crossed that line, it's time to come into the hospital. I do not want you to have any concerns. For example, baby should be moving in between those contractions. You should not be bleeding like a period, right? You can have light bleeding, spotting sometimes in early labor. We call that the bloody show of labor, as that cervix is dilating and the cervix is just more sensitive in general as we get closer to our due date, and especially in labor. Those tiny blood vessels are breaking as your cervix is dilating. This is more like blood-tinged mucousy discharge. This is not a put on a pad and filled up the pad, right? We don't want you in excruciating pain. If we've crossed that line, it's time to come into the hospital. And if your bag of water has broken, you need to have a conversation with your healthcare provider to ask them, how long do I have before I need to come into the hospital? Some things to consider. For example, if you're GBS positive and this is not your first baby, you probably need to come in sooner rather than later, because we need to give antibiotics to you so that we can get enough time to pass that from the mama through the placenta to the baby, so that the baby is covered and protected from being exposed to this life-threatening potential infection. For example, if you are a multip, as in this is not your first baby and you're already walking around at lag 3-4 centimeters, you probably need to come in sooner rather than later if you suspect that your bag of water is broken, because it may not take you that long to labor, right? If you have a history of really fast or precipitous labors, you need to come in sooner rather than later. So that's a conversation that you have to have an individualized discussion with your healthcare provider. But I do find that mamas who do the bulk of the work at home prior to coming into the hospital have a much, much better labor and delivery experience.